Hi folks, Dr. David Cully here with Synergy Wellness in New York City. Today we haven't been treating with him just today, but he's been here, about a week and a half now? About a week?
Yeah.
Yeah. So we have a patient here that traveled all the way from Seattle, Washington. I'm on the other East Coast, New York. He has a unique case and he's willing to share it with you guys. Now, mind you, his case is unique. Every case is unique, but he's dealing with a hiatal hernia, and we're going to go ahead and turn the camera around here so you can meet Arun. Now,
yeah.
Arun has a unique situation where he has been through hell and back again, folks. And you think you've been through hell? Probably a lot of you have, just dealing with hiatal hernia. Listen, there is hope. I promise you, there is hope, okay? And first thing is understanding what causes acid reflux and GERD. But before we do that, I want to touch on what he went through, right? So he's having all these strange symptoms, and he had a couple of procedures which really damaged him in a way that's, luckily it's taken him some time, but he's been able to recover from. He had his esophagus dilated because it was narrow, and narrowing of the esophagus can happen from esophagitis, which is just inflammation of the esophagus, okay? I'm not laughing at the condition, I'm just laughing at doctors have to make it sound fancy. So esophagitis, right? Swelling of the esophagus, and that could come from a couple of things. It can come from something you're born with, it could be congenital in nature, but not as likely, because if it's congenital, you're typically going to know it from a young age, okay? Just to note, do you want to tell everybody how old you are?
I'm 28.
28 years old.
Yeah.
And you can see the height difference here, right?
Yeah.
I'm 6'1", and you are
5'1".
5'1", okay? So he is my wife's height, and he's under weight.
Wait, yeah.
So
82 pounds?
yeah, he weighs 82 pounds. So one of the things is we're trying to get him up to closer to 100 pounds. There's a lot of ways to do that, but one of the ways is to correct his hiatal hernia. So during the procedure, when he had the esophagus dilated, it tore his esophagus. He had an esophageal tear, and it perforated, and you can imagine that would be excruciatingly painful. So
I can imagine how painful it was. It was painful that if I have to rate it from a scale of 1 to 10, it's more than 10. Like,
more than 10, yeah.
and I was in anesthesia, and I felt more. It was It was really painful, even when I was in anesthesia. So
Yeah.
yeah.
Okay. So even with the anesthesia above
I
a
was
10
painful,
pain
really
level,
painful,
excruciating.
more than 10, like, yeah.
So he went through that and endoscopies. Anyway, that was over a year ago. The esophagus has healed, and we are doing the hiatal hernia maneuver on him. Yes. So there's a lot of people out there that are worried about, is it safe? For those of you that have never had any surgery in that region, yeah, I mean, it's perfectly safe. It's an osteopathic technique that's been used for decades and decades. And it's a lot safer than taking your omeprazole, especially when you go past 4 weeks. So those have side effects, right? And the hiatal hernia surgery are really high failure rates. So this is something you could do before you get surgery. Obviously, he had surgery because they perforated his esophagus, so that needed to be repaired. But now he traveled from Seattle. We've been treating him, and we've been treating you for a week now. Why don't you tell everybody your symptoms initially before you saw me?
Before I saw you, I used to be on PPIs like almost every day. So because I couldn't swallow, or even like if I swallow something, it gets stuck in there, and it's just so uncomfortable. I have been to emergencies sometimes because the food is stuck in there, and which costed me a lot because it's an emergency. So
Sure. Any other symptoms
yeah.
besides food getting stuck?
GERD. I've developed GERD, and
So the food coming back up.
then I
Heartburn?
cannot eat like uh, large quantities, at least somewhat large quantities of a meal. Even if I eat a little, I would get a gag or a hiccups, or it's hard for me to. And
Get
it
the
comes
food
the
down.
regurgitation. The food comes back, and then
Yep. So that's the GERD, and then the difficulty swallowing food, dysphagia. Any other symptoms? Difficulty breathing, getting
yeah,
full
and
breath in?
breathing becomes a little bit difficult, and also it feels like something is stuck in the always something is stuck in the chest
Okay.
area.
Okay.
Yeah.
Has there been any changes? So you've been seeing me for a week now. Has there been any changes at all?
I can see some change while I do use the reflux shield. Yeah, so I can say that I can slowly starting seeing like a 10%, 20%. I feel like it's improving. Yeah.
Okay, so this is a real patient, a real testimonial, a real actual patient coming in, not an actor, folks. So he's been here for a week. He has a really severe case. This is a significant case, right? There's probably all sorts of stretching in the hiatus, with the surgery that they went in there and had to go up and repair it. So it's a unique case. The fact that he's had about 20% improvement in the ability to swallow is a big change. Obviously, we're not finished yet, and so he's been treating with me every day this whole week, and this is our last week. We have a couple more treatments, but he took a reflux shield home, and you could show him that. So he's been treating with me once a day, and then the other times he uses the reflux shield. So this is meant to use at home. It's safe. Now, if it's safe for Arun, I'm sure it's safe for you. The only contraindications for using the reflux shield would be if you had lap band surgery, you have an abdominal aortic aneurysm, or if you've had the Nissen fundoscopic or the Lynx surgery, any kind of surgery for your hiatal hernia. So once you do that, can't use the reflux shield. But before that, you can certainly do that. And what this does is it gets to the mechanical cause of a hiatal hernia, the stomach herniating upward. So we're going to actually pull it down for him. So I'm going to show you guys what that looks like. All right, ready?
Yep.
All right. Let's have you lay down on your back.
Okay.
Actually, lie down on your stomach first.
Okay, sure.
So we're going to start on his stomach because I want to look at his hips and his pelvis. That has a lot to do with the rib cage, the alignment of the rib cage, and the connection between the pelvis and the diaphragm. Okay, so let's take a look at him. When he first came in, his pelvis was really out of balance. It's balanced. It's fine. So no need to adjust him there. He's held his adjustment. We adjusted his pelvis twice, I think, in the whole week, and it's held for the rest of this week. So turn over on your back. So let's see. I'm going to show you guys from a different angle here so you can see a little better. Arun, if you could slide your shirt upwards. Ladies, Arun is single, so if you want to leave your phone number, he's single and no, I'm just kidding. Okay, good. He's got a good sense of humor. He laughed about that one. Okay, so for any of you local Seattle ladies, need a nice guy, here you go. Okay. Okay, ready? So we're going to go ahead and start. What I'm going to do is put a little bit of lotion on my fingers because sometimes the skin can be really dry for people, especially in the winter time with our heaters blaring. So I hope you guys can see from this angle. So what I'm doing is I'm just putting lotion here on his stomach, and I'm contacting him right at the xiphoid process. And we're going to zoom in here so you guys can see. And maybe my editing team can zoom in even more. So we're going to follow the ribs together, come to the xiphoid process, and then right off of that, it gets spongy. And that's where, right above that, or underneath my thumb there, is where it starts to herniate, where the stomach starts to herniate above the diaphragm. So I'm placing my thumb in here, and the tip of my thumb is in the center, and the rest of my thumb is just to the left of center. And I'm pushing down. And I usually tell people when you get to a level of 5 out of 10, then you can just stop there and do the scooping motion, right? And the Reflux Shield helps do this and helps you get the leverage that you need to do this yourself at home. He can't do this. I'm standing, I'm a separate, I have the leverage to do this to him, but when he tries to do it himself, it's more difficult. But if you do this and it's helpful to you, but not 100%, then you would want to get the Reflux Shield so you can get in there a little deeper and scoop the stomach out. So that's what we're going to do here. We're going to press down. Tell me when you get to a level of 4. Now for Arun here, we do a level of 4 because we want to make sure that we're not pushing it too much, given that he had surgery. Everybody else I tell, go to a level of 5. And where are you? Are we at 4 yet?
Yeah.
Okay. And sometimes you'll hear some gurgling noise, and and sometimes you won't. It just depends. But that gurgling noise can be the stomach sliding out from the hiatus or the diaphragm. Tell me when I get to a 4 out of 10 pain level. Mm-hmm. Right there. Okay. And then we scoop it out, maintain that same pressure level, and scoop it out. And you can see he's got 2 scars here where the surgery was, right? And I'm going right next to the scar, and it doesn't seem to bother him. We gradually started out at a pain level of 3, and then we worked up to 4. Okay. And he's probably, given the surgeries, he's probably going to need to do this on a daily basis, but most of you can do this technique using the Reflux Shield twice a day until symptoms improve. Then you can go down to once a day and then just use it as needed. But if it's a chronic issue for you, it may take a few months to get to that point. For other people, it could be almost instant. It just depends on how chronic your hiatal hernia is. And we're going to do one more here. Let me know when I get to a 4 out of 10. Mm-hmm. Right there?
A little bit more.
Okay.
Yeah.
Okay. And the more bloated you are, the more sensitive that area is going to be. And that's it. That's the hiatal hernia maneuver, the osteopathic hiatal hernia maneuver. If you're suffering from a hiatal hernia and acid reflux and GERD and all the other weird symptoms, and you can't get the help that you need from medication, consider this technique or the Reflux Shield before you do surgery. It's got an 85% effective rate, this technique. And again, the Reflux Shield mimics this technique. Thanks for tuning in, folks. I hope you guys learned something. And Arun, we may do a follow-up video at the end of this week just to see if there's any changes for him. Thanks. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.